When I went to my GP, I had a worrying that there was a hole in my foot, a wound that I could see that wasn't healing or anything. So I went to the GP and he referred me into podiatry almost immediately.
If you're diagnosed with an active diabetic foot problem, please seek help from your GP, who should refer you in immediately and actually mark it as urgent and state that you have a diabetic foot problem. Here we would actually try and assess what's caused the problem. So is it trauma? Have they had some sort of accident to the foot? What was it caused by? Was it caused by footwear? Was it ill-fitting shoes? And then it's removing this problem. Sometimes you can't heal an ulcer if the circulation isn't very good, so we might have to refer on to the vascular consultant in secondary care. Other times it can be due to high pressures under the foot because they might have joint deformities. And in this case, we would look at making insoles to actually relieve the pressures from this area and try and get the actual ulcer to heal up. If it's a really deep ulcer and it might be penetrating to bone, we'd have to ensure that you get the x-ray done, the right antibiotics, and we might want to monitor you sooner. If there's any signs of infection, we'd ensure that your GP prescribes you the right antibiotics, and also we'd want to see you sooner.
I really think it's important, if you have a problem, to see the NHS podiatrist as soon as possible, as they will treat you, and then also give you follow-up appointments that you can go back, put dressings on your feet, so to keep dry, and then you'll keep going back for however long it takes until they heal up your ulceration for you.
When treating diabetic foot problems, we need to actually take a holistic approach and look at their diabetes control, otherwise their foot problem will not heal. By looking at the diabetes control, we need to actually probably refer on to the dietitian to look at their diet. We might need to refer on to the diabetes specialist nurse or the practice nurse who deals with their blood sugars. We might also have to look at things that are causing problems with their circulation, which could be smoking cessation. We might also have to give them advice on regular exercise. If there was any further problems, we would refer you on, if needed, to secondary care.
We estimate that at least 80% of amputations can be prevented. Prevention is clearly better than an amputation. And the way to prevent these foot problems is to think about the daily inspection and examination of the foot, not smoking, the physical activity, making sure that your blood pressure is good, your cholesterol levels are good, and your diabetes control is also good. If you do all those things, the chances of getting a foot problem are actually quite low. So I wish you all the best in looking after your foot.
The most important issue is maintaining control. Because if I don't do the things that have been laid down for me for care and maintenance of my diabetes, then all things can happen that I don't want to happen.
Well, you really do have to check your feet, don't you? Because you do use them a lot, and if they weren't there, you'd miss them. So you're not going to mind spending a few minutes every day just making sure that your feet are in tip-top condition.